Welcome, everyone. I'm Amy. I'm a nutritional therapy practitioner. Did I say that last time, Nils? Did I say that? I don't think I did. I think I just said I'm Amy. Yeah, I'm Amy. I'm a nutritional therapy practitioner. Yeah. And I'm joined today, as always, by my gravy co-host,
Jason.
Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, what's your favorite Thanksgiving side?
Mashed potatoes with it, and it goes 2 parts butter, 1 part mashed potatoes.
Yes, that's the perfect ratio. Yeah.
It's like butter with mashed potatoes.
Butter taters.
Yeah.
That's like, what are those? Pommes frites. Those are basically just potatoes fried in butter.
Mm-hmm. Yeah.
Dr. Martin, my favorite side, I really like stuffing.
Yeah, I love stuffing too.
Yep. Yeah.
The problem with stuffing is that I like certain stuffings, especially the ones
right.
my mom made, but like sometimes you'll go have stuffing and you're like, this is not that great.
No.
So it's like, mashed potatoes is like you mash the potatoes and you put butter in it. It's going to be good no matter what you do.
If there's enough butter, anything is good.
Yeah.
Dr. Martin is a board-certified plastic and reconstructive surgeon.
That's correct, Amy.
And today,
you're NTP.
I'm a nutritional therapy practitioner. Yes. Today is part 2. So if you have not listened to part 1 of everything you need to know about liposuction, go back and listen to part 1 because we talk all about the consultation, how to find a surgeon, how to know if you're a good candidate. This time, we're going to be talking all about the procedure itself, risks, benefits, recovery. Before we get into all of that, if you're not watching us on YouTube and you'd like to, you can find us at Jason Martin MD and hear all of our social media handles. And I think that's it. That's all I've got before we get into this video. We also opened this beautiful box from Element in part 1. So if you are so inclined, go back and watch that so you can find out what's in this box.
It's amazing.
It's very exciting. Dr. Martin, let's jump into everything you know about liposuction part 2.
I wish we just condensed all the episodes down to this part because we're going to talk about the procedure,
This is the good part.
All right, good.
Well, we're going to talk about the
pre-op appointment.
Pre-op first.
Skip that.
Yep. So you have chosen a surgeon.
Yep.
You listened to our episode, New Beauty Guide, How to Choose a Plastic Surgeon or How to Choose a Surgeon. So
yes.
You've done that. You had your consultation. You got your quote. You're all good to go.
Okay.
Here's some things you should expect at your pre-op appointment. They will take photos.
Of you naked.
Potentially. If we're doing liposuction on your jawline, you will have all your clothes on. They will. Yes. Hope so. Exactly. They're going to review your health history again. If you need any pre-op labs or testing, they're going to give you the request for those, talk to you about medications, when to start, when to stop, medications you're taking, medications that might be prescribed to you, what your options are for medicating before and after the procedure, all those good things. Have you signed consents? Collect your final payment, review the date and time of surgery, and also the location, know where to go for surgery, and answer any questions you have.
Right.
These are some important questions, Dr. Martin.
Yeah. Where will I be taken after surgery? Now, by the way...
Where should I be taken after surgery?
Yeah, exactly.
Home?
Right. A lot of times we do liposuction in the office with people awake. Sometimes we'll do liposuction in the operating room with people asleep. It depends on, and we'll talk about this in a second, but it depends on the amount of liposuction we're doing.
And the person's preference.
So if you are going to a surgery center, it'd be good to know, or an OR, operating room, it'd be good to know where you are taken after surgery, but that's the same as true if you do it in the office.
Mm-hmm.
What medications will I be given or prescribed? And that's for obviously afterwards, for pain control. And if you're awake, maybe given a medication during the procedure to help you relax. Will I have bandages? Will I have drains? Will I have dressings? Yes, yes, and yes. Amy and I always get the phone calls.
Well, you will not, most likely you won't have drains. You'll be draining, but you probably won't.
Oh, I'm sorry. Yeah,
drains.
Draining. I'm sorry.
Yeah.
I was actually going to say a draining comment, but like you tend to drain from the small incision size. After and Amy used the fruit box.
No, that was one of the Reddit comments.
Oh yeah.
Every time, it's like squeezing a juice box.
I still think about that.
I love it. It's the best.
Yeah.
The best analogy ever. Yes, you'll leak like a juice box that somebody squeezed.
Totally.
Mm-hmm.
When are your bandages taken off, or your dressing, compression garments? When are they taken off? When can I shower? That's a big thing. When do we usually have people shower, Amy?
We're usually okay with people showering 24 hours later.
Got it. Mm-hmm. When can I drive? In general, that's dependent on what your doctor says, but it's usually 48 hours after discontinuation of pain medications. And this is the big one, especially in Colorado. When can I exercise? When can I return to normal activities? And when can I go back to work? Mm-hmm. So those are the 3 things.
And we'll talk about all of those when we talk about recovery.
Okay, perfect.
Yeah, we'll go into detail about those. But those are good questions to ask because, those are the things that if you, let's say you have a marathon planned in 3 weeks after your surgery, are you going to be able to keep training? We've had that happen before. Someone's like, I signed up to do a marathon with my mom 3 weeks after my liposuction procedure. Is that okay? I'm like, well, how ready are you for the marathon now? So good questions to ask.
How painful would that be running for hours?
I mean, it depends on the area and how
Yeah.
much liposuction you have. I mean, it may be fine.
That thing would swell up.
That would
so
swell
bad.
like crazy.
Yeah.
Yeah, you'd be in swell hell. Yeah. All right. So that's kind of what goes on at your pre-op appointment. Not a whole lot, just the basics. Let's talk about the risks. So this is still surgery. And this is, I think, the biggest misnomer with liposuction. People don't want to call it surgery. They want to call it a procedure or a little thing I'm having done, or I'm having a little fat removed. But this is still surgery. And it has all the risks of any surgery, which include bleeding, infection, need for additional surgery, all the risks of anesthesia if you're having anesthesia. Even if you're having oral anaphylaxis, you're still having, or ankylosis, you're still having some anesthesia.
You're right.
Top internally, whatever. There's still risks there.
Yes.
Numb hands.
Yes. Yeah. Swelling, bruising, pain. Pain is definitely possible. Pain that's not right away and starts a couple days, a couple weeks, a couple months. You may need revision surgery. Asymmetry is a real risk, especially if you go to someone who's average in terms of their surgical technique. There's so many different possibilities here. If they're using devices, technology with the liposuction, the risk that with many of those is burns and asymmetries from that, subdermal scarring. There's a lot of different risks that goes along with it. So you need to have a conversation with your surgeon and ask them and to have that discussion. What are my risks? How are you going to avoid those risks with the surgery? And what do you do after the procedure or surgery if these risks occur? What do you do as the surgeon? How do you help me out?
Yeah. So one other thing I think that people is definitely a risk is you can have permanent changes in the sensation of the skin. That's really rare. But in our episode where we talk all about nerves, liposuction is pretty aggressive. And you can have some, especially for a few months after surgery, even up to a year, where you almost feel like the area is still kind of numb, but it still kind of hurts. It can feel pins and needly or tingly, or even just like it's not attached. Like your skin feels like it's not attached to the rest of your body. And it's hard to kind of think about what that would feel like until you're experiencing it. But once you have, everyone says well, now I get it. Now that makes sense. Mm-hmm. But just being kind of exquisitely tender. I tell people after liposuction, depending on the aggressiveness of the liposuction and the size and the, amount of liposuction you had, you may feel weird in those areas of surgery for a year.
Totally.
It doesn't mean that it's going to be constantly on your mind, but if you bump into a really sharp counter, 6 months after your flank lipo, ooh, that hurts a little more than it would have before surgery.
Yeah, swelling can persist for a long time. You can have this boggy feeling. That swelling decreases the ability for you to have normal sensation, plus the recovery, having difficulties or pain, ouchy areas, et cetera, et cetera. So that's pretty normal. And it can extend for months and months and months. That liposuction is one of the harder procedures to recover from. It's very doable, but it's prolonged.
It's just longer.
It's prolonged.
It's longer than I think people think, especially because it's awake in office. So you expect there'll be no downtime. One other thing that's really important to mention too is when you're doing an assisted technology is that the risk of burns and or tissue loss is very real.
Yeah.
So if you get a burn from the laser, if you get a burn from the radio frequency, you can have fat necrosis in that area where the fat that is left actually kind of dies and has weird divots. And those are definite things that can happen after liposuction.
Yep.
Yeah. So damage to deeper structures, blood vessels, muscles, lungs, and organs. This is an important one to mention. There was a case many years ago in Canada where they were using Vaser and they perforated a diaphragm.
Mm-hmm. Yeah. Yeah, I found that out the hard way because they sent me up there to give a talk to a bunch of Canadian plastic surgeons about in-office liposuction. And after my talk, which was pretty good talk, one of the surgeons came up to me and said, we're not allowed to do in-office liposuction because a non-plastic surgeon was doing liposuction and stuck the liposuction cannula through the diaphragm and into the person's heart, and they unfortunately passed away right there. So it was devastating, and I felt terrible about giving this talk, but I talked about liposuction too.
Yeah. Risk of DVT or cardiac pulmonary complications. Yeah. We talk a lot about that in our episode about BBL. So when you're doing fat transfer, so you're doing liposuction, then transferring that fat back in, there's some very specific risks with that type of procedure, which you could get a fat embolus, fluid accumulation that may require drainage. That's something that can definitely happen.
Seroma.
Yep. Rippling or loose skin, worsening appearance of cellulite. As we mentioned in our first episode, liposuction is not a treatment for cellulite. If someone tells you that it will cure your cellulite, I would maybe get a second opinion about that, because definitely we tell people that your cellulite will not look better after surgery. It will be the same and or could be slightly worse depending on what area you're having treated.
If you do fat transfer into cellulite, maybe it would look better, but just liposuction alone is not going to solve the problem.
No. And a really rare one, but I put this one on here, is having the cannula break. So this is a cannula.
We've never had that.
We've had a cannula break during
But
surgery,
not-
but not inside somebody.
Not inside somebody.
Well,
yeah.
the cannula was, but the handle was what broke.
No, I
It
understand.
broke at the hub.
Yeah. I mean, it wasn't stuck inside somebody.
No.
Yeah.
But just, I mean, that's something to think about.
And then in terms of complications that you would see kind of sooner after surgery, bleeding or hematoma is one of them. Knock on wood, there's no wood around. Here we go. We don't seem to have that problem with liposuction alone. You can have it with surgery. That's where it would be more likely.
We used to get more seromas with smart lipo. That was
Yeah.
something that I feel like Body Tight really resolved.
And the seroma, again, is an inflammatory fluid accumulation. Anyone listening to this who's interested in liposuction or you've had it, seromas don't usually occur right away. It's usually 7-10 days afterwards. Liposuction is inflammatory. You use devices like Body Tight or laser or ultrasound. They can be pro-inflammatory, and then you're aggressive with the liposuction, because I am in most cases.
Yeah, and your body just sees that as injury.
Yeah, and so it creates this inflammatory fluid that doesn't have anywhere to drain. You kind of disrupted the lymphatics, and so it accumulates, and that sometimes has to be aspirated. Some people do drains with liposuction.
They do.
Some people do.
They do.
Some people
Sorry.
use drains with liposuction, especially if they're higher volumes, for this reason, that to mitigate seroma risk. Soft tissue deformities and irregularities, we talked about that before, and burns, delayed wound healing, all these things can occur. Asymmetries, you see that a lot, where people come in and they just don't have a nice contour, and that's technique driven. Maybe
Or they
that's,
get too much fat taken out.
yeah,
It's way harder to come back from.
It's most likely technique driven, at least in my analysis of people that come into our office, but it can be related to inflammation during healing. I've had someone we done liposuction on, and then afterwards they had a traumatic event, a motor vehicle collision with a family, and then they had really high cortisol levels, and they just weren't healing right, so they were in a kind of distress situation not related to the surgery itself.
And touch-ups can need to happen. So like
Yeah.
small asymmetries, even in our hands or in your hands, like it happens. These are not end of the world things.
Right. And those, you can do those in the office very easily. Okay.
Yeah. All right. Let's take a quick break and we'll be back.
We'll be right back.
And we're back. Now we're getting into what everybody's really here for. They want to hear about the surgery.
Yeah, thank God.
So we are now going to talk about, like, you've been through your pre and post, you've been through your pre-ops, you're good to go, you know about the risks, you are well informed, you've paid for surgery, you got your meds, you did your labs,
Yada, yada, yada.
you are ready for surgery.
Yes. Good.
So here we go.
We're here. All right, liposuction. Amy, 2 ways to do liposuction. You can do it awake or asleep, right? Awake would be, in our case, in the office. I guess you could technically do it.
We used to do awake in the OR. Or
Yeah.
we did in that little, the room where they did the colonoscopies, their little semi-sterile area.
Yeah. Okay. Well, that doesn't sound very sterile, where there's colonoscopy there.
Well, no, I mean, it was clean. It just it wasn't like for like,
A
big.
procedure room.
Yeah, it
This
was a
is called
procedure
like that,
room.
not the colonoscopy
Yeah.
room. So you could do it awake or asleep, and asleep would be with most likely IV sedation or general anesthesia. Awake procedures, at least in our office, we usually give medication. Halcyon's the one we give, but they could give anything they wanted. People use Pronox, which is nitrous oxide. There's all these different things you can use with someone technically quote unquote awake, but with oral sedation, something that you take by mouth. The ones in the operating room, or at least be through the IV or a tube in the back of your throat to help you breathe, and heavier anesthesia.
And either way, you'll get tumescent. So either way, the area itself will be numb.
Right. No matter what, when you come in, the surgeon's going to mark you. They're going to encircle the areas of fat, most likely, and they're going to kind of mark the areas where the incisions are going to be. And if it's in an operating room, you'll meet the nurse, the circulating nurse that's going to be in the operating room, and also the anesthesia team. The anesthesia team will talk to you about the risks and benefits of anesthesia. And that's really it. I don't think I'm missing anything in that part. Yeah. The next step is taken to the operating room or procedure room. If you're awake, we'll inject some local anesthesia. That can hurt a little bit when it goes in. But
Well, first we make.
You're not going to make an incision without doing anesthesia first. Right?
Well, yeah, but you were talking about doing the tumescent.
Oh, yeah.
Yeah, like
Okay.
we don't do the tumescent without making a hole.
Yeah. Okay, that's true.
Yes.
Yeah. You make a small incision. And that's the key part of liposuction.
Tiny little stab.
Tiny little stab incisions that heal really well.
Yeah, a lot of doctors don't even put sutures in them, which we talk about with the closure. Like a lot of times they're left open. They're so tiny.
How often do you see these little incisions being a problem with our patients? I mean, Not very often. Sometimes they can get a little bit red.
Yeah, no, with our patients, no. I mean, it's different if you're having like a larger volume liposuction procedure. Like the areas can get a little bit angry for a little while, but they always end up healing well.
Okay.
Yeah.
Cool. We'll inject a little local anesthesia. Amy's absolutely right. We have to make an incision, and then we insert a cannula that injects tumescent fluid. Tumescent fluid is saline mixed with lidocaine, and it's a numbing medication.
And epinephrine.
With epinephrine too. And even if you're asleep, this is really important.
Yeah.
So if you're awake, obviously you need to numb the area up, but when you're asleep, you want it still to be numb because you don't want to be sensing pain while you're asleep, which will elevate your heart rate and blood pressure and could be a problem for surgery itself.
Well, and it reduces bleeding. Like you go back in the day and read about old liposuction techniques. They call it dry liposuction, where they'd literally just go in and just start sucking out fat. Yeah. So the reason for tumescent, which was, kind of created by a dermatologist.
Right.
Yeah.
They actually had a couple deaths.
Yeah.
It was not good.
Yeah. So the epinephrine kind of helps stop bleeding. We also put a substance called TXA in our liposuction tumescent now, which further helps with reducing bleeding because, again, your body doesn't know what's happening. It just knows that it's like shocked and stuff's being ripped out of it. So all the things you can do to make it as gentle a process as possible.
Right. So
for your body.
You're injecting the tumescent fluid Amy's talking about in the area of treatment. So if it's your belly, your flanks, your thighs, your arms, or all of the above. And the next step, if you're using a device also with the liposuction, would be to administer the energy. The energy would, like we said, in our office, we use body tight, which is radio frequency. And this is where you would melt the fat.
Or disrupt it.
Like you do with ultrasound. And then tighten the skin, usually with heat or electrical current that creates resistance, which then ultimately creates heat. And these devices are really what have taken, at least in our office, liposuction to the next level. So they're important, but they're not absolutely necessary. You can have liposuction alone with really good results.
Yeah.
So you don't have to do these devices.
No, and no device is going to replace bad surgery.
Right.
Or make up for bad surgery.
Once that's done, and it's really, these devices are helpful because they liquefy the fat. Maybe that's not the right word, but put it into like a milkshake kind of consistency, and then it's a lot easier to suck out. And the suction part is actually a cannula that goes underneath your skin with a hole in it. There's a vacuum hose hooked up to it, and it literally sucks out the fat in the area that you're treating.
That's where the magic happens. I always tell people like, oh no, I'm throwing this fat in the trash. Like when they ask me if their fat's going to come back, like, nope, this fat's going in the trash.
Right.
Like this fat is never coming back. But Jar of Marbles theory still applies. Dr. Wharton, the reason I put disrupt on here was actually because we didn't talk about fat transfer specifically, but if you are having fat sucked out, a lot of people do want something like a BBL or some fat volume in their breast. What types of technology can be used in those situations?
Yeah, ultrasound is the main one. If you're going to use
Beauty fill?
Yeah, and Beauty fill would be good too. It's a laser technology. Both of those would be useful. You can have some skin tightening with those, not as good as radio frequency like body tight, but it doesn't destroy the fat. You cannot use body tight treated fat for fat transfer.
Because the cell is destroyed.
Yeah, everything's destroyed.
Yep. Yeah, it completely destroys the cell wall. Whereas with Vaser, we kind of talked about that in the first episode, that it causes like a vibration. So it's like shaking grapes off the vine is how they always describe it. It kind of breaks the fat cells up, but keeps the cell membrane, that phospholipid bilayer that I love so much, intact. And the same thing with the Beauty fill, that laser frequency is not hot enough to destroy the fat cell. Mm-hmm. So they are still viable. So you can use those to inject. We actually did a training. We had a doctor come do a training in our office, and he was so funny. Like he's like, oh, I would never throw fat away. It's like liquid gold. Yeah.
He said it's a national resource. Yeah. That's exactly what he said.
He'd be doing like micro aliquot.
I was like, that's kind of interesting, but okay.
Everywhere. Like, yeah. So
he always used the fat.
Yeah. And fat is magical. Again, go listen to our episode where we talk about fat, all about fat, because it really is. Your fat is doing a lot of work. It's the heavy lifter in your body.
Such a good episode too, by the way. You're bringing up all the good episodes.
Yeah. And then step 4.
Yeah. Well, real quick on this. So when you aspirate, when you suck the fat out, this is the part where it really takes technique and in some ways talent.
That's where things can go really wrong.
Yeah. Mm-hmm. And so there's such a sculpting, artistic part of this. Now, the surgeon you go to doesn't have to be an artist or a sculptor or whatever. It doesn't have to have all these elements that are related to creativity, but they have to have some ability to look at things three-dimensionally.
Yes.
And decide that
especially when somebody's laying down.
It needs a little more here or there. This is very much about what your eyes see and making your hands sculpted out. Also, there's something called high definition liposuction. We offer that in our office, not very often, but that's really aggressive liposuction that's taken to the next level, especially in the abdomen, right? You better darn well be sure that person who's doing aggressive liposuction, very aggressive, superficial, right underneath the skin liposuction, they know what they're doing.
Because to fix that is really hard.
Very, very difficult. So I think it's important personally, and I'm prideful about my liposuction results, that you go to someone who is prideful about their liposuction results, does embrace this surgery.
But who's also realistic about what's achievable for someone's body.
Right.
Like if you do not have muscle definition, someone trying to etch in abs for you, probably not going to look good. Think of those the shirts you get at the beach, like you don't want to look like that. Like it looks odd.
You got to have something on the base. And then also it doesn't really age well. That's the other problem of it. 10 years from now.
Over aggressively treating the deltoid area. Like it just looks really weird. And like you said, it doesn't age well. Things don't look right. So
and we do treat all these areas where it's not like we're saying we don't treat them. Like
we're just not trying to fake something.
Right. I definitely do like midline raw phase. Mm-hmm. I do some real sculpting elements on the abdomen. It's really kind of cool stuff.
On people who have the muscles to back it up.
It's usually someone who's a little bit younger and has good skin quality. And
a bodybuilder. Right.
So I think it's important to go to someone who has good technique. And then the other part of it is...
yes, that is key. We have a whole podcast episode talking about why that's important.
I know, but I don't want to sit there and I feel like I'm just beating a dead horse somewhat. But I think it's just so important. But the other thing I want to say is that if you're awake versus asleep, no question, I could be more aggressive with someone asleep.
Yeah.
So if you're thinking about liposuction, you're like, I really want to do it awake, save some money. I don't have to have anesthesia, but I really want to have the best, most transformative results. In almost all cases, besides small little areas, asleep is better. I can be way more aggressive. I can have more transformative results. I mean, I've proven that over our career, that the results are better with someone asleep. But it doesn't mean awake results aren't awesome too.
Yeah.
And it's a trade-off, right? So you could be awake, no general anesthesia, don't have to go to an operating room.
Yeah, get a 98%.
Yeah, it's pretty close.
Yeah.
So 95%, 94% of what asleep would be. So if you want that little extra sauce, asleep is where you go.
Yeah. The other reason, though, that you would need to be asleep is if you are having multiple areas of liposuction done, because you do reach a limit of how much local anesthetic you can be given. And that's very important. So if you're, wanting to get a lot of areas done, which we definitely recommend, that would either mean breaking it up sometimes into 2 cases in the office, which some people choose to do, or just getting it all done in the OR. And this is where going to a doctor who has that ability to take you to the OR, which means they are a board certified plastic surgeon because they actually have hospital privileges.
Right. They're not in some janky office.
Yeah.
Yes.
If someone's trying to tell you oh no, it'll be fine. We're going to do 2 days later, you come back and we'll do the rest.
Which it's called stacking. You could definitely do it, but that's actually dangerous in itself.
It's dangerous. And why don't they have the ability to do it in the OR?
So the reason you cannot do a high number of areas in the office is that there's only a finite amount of lidocaine that you can use. Lidocaine toxicity, overuse of lidocaine is deadly. It's one of the few things that can happen with the surgery that can actually cause death.
Yeah.
So you have to be very careful about how much lidocaine you give. And obviously lidocaine is the only way that you can tolerate this procedure. It's the local anesthesia.
Yeah. So very important.
And then closure, these small little incisions are super small. I don't even know what that is in measurement. A couple of millimeters.
Yeah, at most.
Yeah, and those are closed, and
sometimes we do sometimes leave them open, and some doctors always leave them open. I mean, that's how tiny they are. Some doctors leave them open because they want to facilitate drainage, but you're going to drain no matter what. Yeah. That hole is going to not. It's not like you put a suture in it and it's so tight that it can't get fluid out. So
totally.
Yeah. All right. Well, there we go. Now you know what's going to happen during your surgery. It's a good time. Lipo procedures to watch them is, I think everyone who sees lipo for the first time is like, wow, that looks like a lot of work. I would say this is why Dr. Martin works out.
That 100%. Liposuction is one of the few procedures that I lift weights for.
Yeah, it is physically
Faceless,
demanding.
It would be more like meditation and flexibility, but liposuction's like straight bruticane.
Oh yeah, well on days where we do 3 lipo cases in a row.
Sweating.
Yeah, it is a lot of work.
And what I always say when you're awake, if you suck it up, I'll suck it out.
Mm-hmm.
Yeah.
So it's a team effort.
It is a team effort. Are we missing anything?
I think that's it for the actual procedure itself. Yeah. Okay. And then we clean you up, we get you home. Yeah.
What about garments at the time of surgery?
We will talk about that.
Great.
Yeah. So let's talk about recovery. Good segue, Dr. Martin. What about garments at the time of surgery? Yeah. So before, what I always say is you need to prepare for recovery. And preparing for recovery starts before you are actually home from the hospital or from the office. This is not when you start preparing. You need to prepare for recovery before surgery. And that includes reading your post-op instructions. And reviewing them with your
What are you talking about?
primary post-op caretaker or caretakers. It's important for the person who's taking care of you, especially if you have been given a medication like Halcyon that makes you not able to make good decisions for 24 hours.
It's anterior, oh my God, I'm turning into anterior grade amnesia, meaning you get amnesia going forward, not backwards. You remember everything before, but not during the process.
Well, and it also it takes down your walls a little bit. I always say, like, if you've had maybe just a little too much to drink, like you're just that slight edge of tipsy where you think everything is a great idea.
Everybody in the club's getting tipsy. Yes.
Like driving your car or online shopping. So, those are important things that the person who's going to be taking care of you knows, like, hey, don't give her phone to go online shop, or maybe do, but be ready for the consequences.
Is that when you get inappropriate comments from your patients?
Oh yeah, try to get him to strip at a birthday party. Yes,
a lot of you're handsome.
Yeah. Like, Doctor, why you want to come to my girl's party?
That's when you know they're sedated, when they start calling me handsome. They're like, listen, you're compromised. You're not thinking right.
Know when and where your first post-op appointment will be. So if you had your surgery at a surgery center, your post-op appointment will likely be back at your doctor's office. Or your first post-op appointment may be via video. So you're going to be at home. So just know that ahead of time. Get your prescriptions filled. Can I shout this from the rooftop?
What? What are you talking? You're saying all these crazy things. Like, what are you talking about? Filling your prescriptions beforehand so you don't have to make your loved one go out and get it afterwards when you're in pain and crying?
Please fill your prescriptions beforehand.
Oh, that's just crazy. Yes. That's a crazy thought process.
Purchase recommended post-op products, which may include garments, ice packs, my pillow system to facilitate better sleep. Support and facilitate. That's facilitort. That is how you facilitate something.
That's efficient use of English. You just keep compressing it down.
We're just benefering
to
everything.
To the most efficient word possible.
You're going to faciliport. The pillow system, even with lipo, it's nice to have extra pillows to kind of help yourself sleep in a more comfortable position. Think about the things you use on a daily basis and move them to as close to waist height as possible.
Yep.
Especially if you have liposuction on your abdomen, you're not going to be spending a lot of time bending over, which is also why you want easy to put on, dark colored, because you will be leaking, easy to put on clothes, and slip-on shoes. Definitely slip-on shoes. And this one is the most important thing.
Completely and utterly normal to be nervous and also to be excited. It's also normal to take off your garment and look in the mirror and be aghast at the Frankenstein-looking belly that you have.
Well, and you got Sharpie all over you.
Yeah, Sharpie and you're bruised.
You're all blanched still.
It's not gonna. This is not a reality show.
Yeah.
You're gonna look like a train wreck hit you. Okay, and then it's gonna be better. So just take it day by day, easy strides. But yeah, it's nervous, anxious, pain.
Well, nervous and excited. This is before surgery.
Yeah, I know. Yeah,
you're not in pain.
Yeah.
This is before surgery. You're in pain before surgery.
No, I'm saying afterwards. Yeah, but excited at the same time, and hopefully that excitement carries over.
Yeah. All right. So you're prepared for recovery. Now let's actually talk about recovery. This is what you were getting at, Dr. Martin. Initial results: pain, swelling. The great part is you won't feel. You'll feel like it's coming, like the hurt's coming. Like you'll leave here being like, oh yeah, I'm good, but it's like sore. About 4 hours later, when that lidocaine starts to be fully absorbed, it's like leaving the dentist, right? Like you're numb, like you don't feel pain, you're numb, but you know that this moment is coming. And I tell people, like, it is going to feel like you are full of lava on the inside of you when that numbing wears off. It's going to feel hot. It's going to be burny.
You're going to start having deep conversations with yourself, like, ayahuasca level. It's going to be.
It's more that it concerns people because they feel anything when they've felt nothing for several hours. Like, why? I didn't feel anything for like hours. And then all of a sudden it started to hurt. Like, yep. Like the lidocaine is being absorbed. Now, again, we might be overstating it. Like liposuction, we do say is one of the more painful things we do. Now, does this mean it's intolerable? Absolutely not. Hundreds of thousands of people get liposuction every year. It's absolutely
one of the most
tolerable.
common procedures that plastic surgeons do.
Yes. Take Tylenol, like you'll be fine.
Yeah.
You probably have some bruising. Again, bruising is patient specific, technology driven a little bit, like how much you bruise, how much you don't bruise. That's all part of it. Stiffness, or limited range of motion. It's the November. I just can't. It's the time change. That's what's doing this to me. It's the darkness. I don't even understand it.
Or it's your grasp of English.
It's that too. English is my first language. It is my only language. I speak it proficiently.
For such an intelligent person like you.
The sniffness.
On the struggle bus with these words. Just keep going.
You will have stiffness and limited range of motion. Now, part of that is like if you sprain an ankle. Part of the reason that you can't move it very well is because your body swells around it to protect itself.
Yeah, swelling fluid is a protective measure by the body, but it also makes everything stiff. It's difficult to move. It's sore when you move, and just doesn't feel great. it's achy.
Yeah. The other thing that I think I get questions about the most, especially for people who have liposuction on the flanks or that kind of like that back fat area, like the lower back fat, the spare tire, the muffin top area in the back, is that their buttocks or their hip is a little bit tender or numb. And that's just that kind of tumescent effect traveling, but also that swelling, it's going to travel. It's not like you just isolation swell. So like, it's really common to have it go to like the next like joint area. So if you have liposuction on your lower back, like those hips can be kind of sore for a couple of days or feel like they have limited range of motion.
Yeah, the hips don't lie, Amy.
Yeah, they don't. And people ask about that. That's pretty common. The next day when I talk to people, like, well, my hips really hurt. Like, but did he do something to my butt? It hurts too. That's pretty common. I'm like, no.
These like conversations you have with these patients.
Yeah.
What did he do to my butt? What did he do to my labia? What did he do to my ear?
Why is my scrotum purple?
Why is my scrotum swollen? Did he do something to my scrotum? You were awake.
Well,
you would have known if I had manipulated your scrotum.
No, but you don't understand. It's really purple. Like, yeah,
I do understand.
Yep, I get it.
We got it, man. We got it.
Yeah. So
Purple scrotum.
bruising is also something that gravity can kind of pull it into areas where you didn't have surgery. So again, if you had liposuction on the abdomen, you may have really swollen labia. You might have a purple scrotum. Like these are normal things, but definitely bring them up to your surgeon either way. So week one, you get limited impact activity. Things that jostle you around or impactful are not going to feel good. We also don't want to shake those areas of surgery. It's just not going to feel good. And they're going to cause more swelling. You can have unlimited, easy walking.
Walking's great. Why is walking good? We say this every time.
Stimulates lymphatic flow.
Nils already knows all this stuff.
Yeah.
He could tell us.
Yeah, it's good for your lymphatics. Like that's how your lymphatics are moved. Inflammation, fluid is moved by movement. So you got to be moving.
Nils, is walking good for recovery?
Absolutely, in every way, and it keeps the blood flowing and helps prevent blood clots.
Yeah, there you go. Keep going, Nils.
And any kind of like just getting some kind of exercise rather than just being caught up in a chair is absolutely
right. Especially with
better.
liposuction.
Mm-hmm.
Yeah,
if you're immobile,
get the blood flowing.
Yeah, if you're immobile with
it's gonna hurt
liposuction, and you, especially in a sitting position, and you've had it on your belly and it's creased out, and then you stand up, it's going to be painful. It can look deformed. Like walking is so good. And walking, when you stimulate the blood flow, it stimulates the lymphatic flow too at the same time.
Helps with swelling a lot too.
Yeah,
Right? But you don't want to overdo it because if you push it too hard, then that can
Well, that's why unlimited easy walking.
Yes,
easy.
No
exactly.
impact. Yep.
Easy.
No jostling.
Easy. Yeah, and careful walking the dog because if it pulls on you, you're going to hurt.
Oh yeah,
You don't want to fall.
Nils is always paying attention. It's amazing.
Yeah, you want to avoid anything that could make you fall. So having a dog pulling on a leash is not a great idea. Pain medication, most of our patients, we just do Tylenol. Couple of days maybe of prescription pain medication for really big lipo cases. For our in-office cases, we don't prescribe it. We just do Tylenol. For big OR cases, we'll usually give them a couple of days, like 5-10 pills just to get them through those first couple of days before switching to Tylenol. You're going to wear a compression garment or supportive clothing most of the time. So this is, nearly 24/7. It's just going to feel better. Now, any doctor who tells you, now go back to our myths episode. This is really important. Go listen to the myth about compression garments. Compression is not magic. It feels good. It does help with swelling. But if your surgeon tells you that the reason you had a bad outcome was because you weren't compliant with your compression, you only wore it for 6 weeks and they told you to wear it for 3 months, that's just not true. Bad compression can definitely make a good result not as good.
Yeah.
Like that is real. Like Dr. Martin mentioned, if you're sitting with a crease in your abdomen every day, like that crease can become permanent. Or if you're wearing a really tight belt or wearing compression that is ill-fitting or has zippers or weird things digging into you at the same place every single day, that's not great. So more compression is not the answer in most cases. Make sure you clear your compression garments with your surgeon. I'm not telling you what your surgeon told you to wear is wrong. I'm just saying make sure you clear them with your surgeon first.
Yeah, this is a tricky comment because all these surgeons sell compression as the means to have good results, and good results come from good surgery.
Right. If that was the case, then we'd all just wear compression.
Yeah, just wear it. Don't even do lipo.
Yeah.
Just wear it by a compression
just
garment.
squeeze it and it'll go away. The Victorians proved that was not real.
But there's a lot of dogmatic thought process when it comes to compression garments and plastic surgery.
We should do a Reddit deep dive on compression.
I don't know about that. I feel like we're going to get a lot of hate mail from plastic surgeons because
because so many plastic surgeons
they
listen
hold
to our
on to it
podcast.
like a pacifier. It's like so bad. Anyways, but compression can maybe limit the development of seromas, theoretically speaking. But it does feel good, and that's the main thing.
It's like swaddling a baby.
Right. Any kind of irritation or inflammation specifically related to your nerve endings, constant compression is really soothing for you. And you know that if you've ever been stung by a bee, holding pressure on something, your ankle.
Pain, that's our immediate response. Like, ouch, what do we do? We squeeze it.
Right. Wrapping your ankle after you sprain it, it just makes it feel better.
Yeah.
So,
Tricks the brain a little. Yeah. But wear your garments as prescribed by your doctor.
Whatever they say to do.
Do that. Yep.
Okay.
Most likely you're going to be returning to work unless you do something that, requires you to be in a pool maybe, or like doing something where you're going to, if you teach a sport or you teach water, you teach aerobics. We have some patients who teach like aerobics classes.
Sure they do.
Like you might not be able to teach Zumba right after your lipo, but for most people, you're returning to work and returning to driving. Again, follow your doctor's instructions and definitely don't drive while you're on pain medication or on Halcyon. So first week, I always say after lipo, everything happens. It just happens slowly. It is the turtle. You are the turtle. Like life goes on, just happens slow.
She really says this to people. Do. Yeah.
And then they come in and they know they're turtling. And you turtle for that first week. Like you really do. Like you turtle. You turtle getting in and out of the car. You turtle doing everything. It happens.
And that's true even if it's your neck. Like it's a little easier with your neck, right? Because it's not part of your torso or your arms. But even those areas, you're kind of like, oh, it's sore. It's, you're kind of moving slower.
Things happen. Yep. Weeks 2 and 3, you're still going to have some swelling, but your range of motion is probably back to pretty much normal. You're feeling much better. Like things are still sore, but not all the time. You have discomfort with pressure, some movements, but it's not really pain. It's just discomfort at this point. You're still doing compression probably half the time. And you've returned to most exercises and activities. And I say most because that's, there's still gonna be some that you probably want to avoid. But at 2 to 3 weeks, you're pretty much back to doing everything. Yeah. The turtle is turning back into the hare. Life is moving on. Weeks 4 to 6, you're still gonna have some swelling that ebbs and flows day by day, week by week. It's gonna kind of come and go. You're gonna feel like it's gone and then it comes back and you kind of get frustrated and it's gonna go away and it's gonna come back. But it's gonna be always trajectorying down. Like it's gonna swell less each time.
Yeah.
Bruising should be gone. Even our people who bruise like super aggressive, by 6 weeks, your bruising should be gone.
Right.
You're going to be returned to most of all of your pre-op activities, exercise, everything, impact. You can be done with compression for the most part, unless you still like it, which is fine. Tell the story about the triathlete.
Yeah, we've done it so many times.
Yep. So if you like your compression, keep it, but it's not magic. Again, you might be able to stop topical scar treatments at that point in time if you choose to. But again, these are tiny little stab incisions that are well hidden. So it's rare that we actually even recommend it.
Yeah. By the way, that's another pride thing. I put my stab incisions in the area of clothing, like your underwear line.
Natural creases in the body.
Yeah, or like your belly button.
Yeah,
I don't just like
little arm crease.
Yeah. We see people that come in. They're like,
oh my gosh, it's like a general surgeon was like, here, we'll go here and here, and it's like maybe there.
It's like they were throwing darts at you, trying to figure out where that lands, and that's where they do the incision. So again, that's a thought process, pride in your technique and what you're doing. So maybe ask that question too with your surgeon. Amy, the last one.
Week 7 and beyond.
Yes. Return to exercise, return to normal activities, and most importantly, love your results. Liposuction kicks ass. You're going to love it. You're not going to regret it if you're a good candidate for it. And it really is good. It can solve a problem, which is fat, resistant fat in a pocket area that you don't like, that affects your clothing, affects your self-perception or how you feel. Skin. Yeah. And it can make it better for sure.
Dr. Martin, where in this scheme of weeks would you recommend somebody go on a beach vacation? It is November. If somebody wants to go spring break.
Oh my God.
Somebody wants to go on vacation in January.
I'd wait through a majority of the healing.
Exactly. Yeah. It is week 7 and beyond. That's where love your results happens. Liposuction, we have a really old episode where we talk about procedures you can do in the summer. And lipo is not on there. I mean, it is on there as like a thing you can do in the summer, but you need to think about, you need to backtrack. I would say 3 months. If you are going on spring break, hey, you're listening to this episode in November, you need to have scheduled your consultation already because you need to be having surgery at the very latest in January. Yeah. If you're going on a beach vacation in March.
When you're getting your tax stuff to your accountant, that's when you want to do the lipo, right? January.
End of the year. Yeah. Yeah. Because if you've got summer plans, I mean, it does take some time. I mean, I'm not trying to overstate the swelling, but if you want to be feeling really great about your results, you got to give it those, beyond week 8.
Yep.
So 2 to 3 months at least before you're wanting to show it off, before you are wanting to have a dress fitted, before you're, doing anything like that. Yeah. We covered it. Dr. Brian, that is everything you need to know about liposuction.
I mean, I'm exhausted, but I'm also exhilarated at the same time.
You did some liposuction today, so yeah.
I did liposuction today.
You did.
Yeah, and a neck lift too at the same time. Yeah.
Yeah.
Wow.
Yeah. So we covered so much in this episode. I hope everyone has some really awesome Thanksgiving plans.
Yeah.
Gets all the good sides. I'm in it for the sides. I mean, I love turkey, but like I can eat turkey anytime. Like I want some cranberry. I do slow roasted cranberries. So I roast them in the oven at like 200 degrees. So they turn all like candied and juicy. And like the berries are still almost whole, but they burst.
Right.
Oh,
I think most people, I mean, I'm the same way. I think most people prefer the sides. The sides are what Thanksgiving is all about.
I do love turkey.
And desserts. People love the
I
desserts.
kind of I lump those into the sides.
Yeah.
Yeah. I'm not a pumpkin pie fan. What's your favorite Thanksgiving dessert?
A pumpkin pie for sure.
Really, pumpkin pie? What about you, Nils?
Oh, I usually like fruit pies and stuff like
Fruit
that.
pies.
Yeah, apple pie, stuff like that. I like apple crumble. I
Ooh,
really
yeah.
like
A good apple
or
crisp.
Peach cobblers
Let's go.
and stuff like that.
Let's
go.
So,
I'm down with that,
especially if
too.
you got good fruit, good
yeah.
berries.
Oh, yeah.
There's nothing like it.
Right?
So, yeah, I'm down.
I mean, I guess Thanksgiving's not really fruit time except for apples. The berries
Yeah,
are a summer
it's
thing.
Not exactly.
Yeah.
It's a,
That's not a fall pie.
Yeah, I go for the savory for Thanksgiving.
Yeah.
The mashed potatoes, garlic
Gravy.
mashed potatoes,
Stuffing.
gravy,
Mm.
mixing them all together and making that slurry on your plate.
Yeah,
Just
the
going
cranberry
Cranberry
gravy too.
sauce on the side, sweet potatoes. All right.
I feel like we should just go eat right now.
Exactly.
I'm hungry.
And then, see, it'll be perfect timing. You get your liposuction in December. It's not for weight loss. Listen
Yeah.
to episode 1.
Get through the holidays,
Yep.
gain your weight, and we'll suck it all out because it's a
Absolutely
weight
not.
loss
Definitely not.
technique. Right, Amy?
Yep.
You
What
can
does it
lose like
say?
10 or 20 pounds. It's better than Ozempic.
A moment on the lips, forever on your hips. We got the cure for that. All right. Well, thank you everyone so much for listening. If you would like to find us again, definitely give us a like and a follow. We would
Yes,
really
we love
appreciate it.
that.
Helps other people find us as well. We have a great episode coming up on December 1st. We're going to be answering some questions that have some awesome follow-up. So if you sent me a follow-up to your question that was answered on our last episode, I'm going to talk about that in our next
So
episode.
we're doing the double question, double follow-up, the follow-up from our answer, and then they're going to come back
They
with
came
more
back
questions?
with
Oh,
more
man.
stuff. It's really good.
This is getting into
Yep.
the intricate. I
Yeah,
love
there's
it.
some great stuff coming. So thank you all so
Yeah.
much for being here. Enjoy your Thanksgiving with your family.
Yeah.
Eat everything you want. There are no macros on Thanksgiving.
Yeah, we're thankful for you. Thank you so much.
Bye.